Have you ever felt short of breath, a strange flutter in your chest, or a wave of unexpected fatigue, and told yourself it must be age catching up with you? So many seniors say those same words in my office, and every time, I feel the weight of what they might be overlooking. These feelings may be subtle, but they are never meaningless. One of my patients, a woman in her early 70s, once told me she thought her breathlessness was simply her heart, working a little harder now that she was older. She lived with those sensations for months, believing they were harmless. But what we eventually discovered was that her asthma had been quietly placing extra strain on her heart, turning each shallow breath into a challenge her body was trying to hide. I want you to imagine this for a moment. It is late evening, the house is quiet, the lights are dim, and you are settling into bed. Suddenly, your breathing feels heavier than it should. Your chest rises a little faster. Your heart thumps harder, not from fear, but from effort. You shift your position, hoping the feeling will pass. It might, but the message your body is trying to send you remains. There is a powerful and often overlooked connection between asthma and heart health, especially for adults over 60. When the airways are inflamed, the heart must push harder to deliver oxygen. When breathing becomes even slightly restricted, the heart senses the struggle long before you consciously notice it. From years of caring for older adults, I have seen how chronic airway inflammation increases cardiac workload. I have seen how recurring episodes of breathlessness reduce oxygen levels just enough to tire the heart. And I have seen many seniors misinterpret these signals, assuming they are simply signs of aging or mild heart trouble. Stay with me through this video, because understanding this connection can change the way you care for your lungs and protect your heart. And if you find this helpful at any point, please remember to subscribe, like, and share Senior Health Daily so we can continue supporting your wellness journey. In the next part, we will explore what every senior needs to know about this silent partnership between the lungs and the heart. Why asthma and heart health are closely connected. As we move deeper into this conversation, I want you to picture something that happens every time the lungs struggle. When the airways become inflamed, even slightly, the amount of oxygen reaching the bloodstream decreases. The heart, always listening and always protecting, immediately tries to compensate. It beats faster, pushes harder, and works overtime to keep the oxygen supply steady. For a younger person, this extra effort is uncomfortable, but manageable. For someone in their 60s, 70s, or 80s, the heart does not always have the same resilience it once did. Many older adults experience a tightening in the chest or a fluttering heartbeat and assume it comes from their heart alone. Yet, in many of the cases I have treated, the underlying issue begins with the lungs. A mild asthma flare, one that barely causes noticeable wheezing, can activate the body's stress response. When this happens, adrenaline rises, blood pressure increases slightly, and the heart begins pumping with more force. This interaction is subtle, but over time it becomes a strain that few seniors realize is happening. In my years of practice, I have seen countless patients treat their heart diligently while completely overlooking their breathing. The truth is that these systems are inseparable. When asthma narrows the airways, the heart is the organ that must carry the burden. And for seniors who already have stiffer arteries or mild heart conditions, the impact is stronger and faster. This is why understanding the connection between asthma and heart health is not just interesting, it is essential for well-being. Hidden asthma symptoms that stress the heart. The most alarming part of this connection is that many of the asthma symptoms that strain the heart are not dramatic. They are quiet, gradual, and easy to dismiss. One of the earliest signs is prolonged shortness of breath, the kind that makes you pause after climbing a single set of stairs or walking from one room to another. Another subtle sign is a cough that lingers at night or interrupts sleep, but never seems severe enough to label as asthma. There is also a type of chest heaviness that many seniors interpret as fatigue or heart weakness, when it is actually the lungs fighting to expand. Even the sensation of palpitations, that quick jump in heart rhythm during exertion or stress, can begin with airway tightness. And perhaps the most overlooked sign is unusual tiredness after small activities, like making the bed or carrying groceries. When oxygen levels dip even slightly, the heart must accelerate its work. This extra load creates a ripple effect, leading to exhaustion faster than expected. The science behind these symptoms is fairly simple. When the airway narrows, airflow becomes restricted. The heart, sensing a decrease in oxygen, increases cardiac output to compensate. This combination of restricted airflow and increased heart effort is something I see almost weekly in older patients who had no idea their lungs were involved. They look at me with surprise when I explain it, because the symptoms feel so scattered and inconsistent. You may be surprised how many times seniors attribute these signals to age, cold weather, poor sleep, stress, or even anxiety. But recognizing the pattern early makes a tremendous difference in protecting both the lungs and the heart. How aging changes the asthma and heart equation. Aging changes the entire conversation between the lungs and the heart. The lungs naturally lose elasticity as part of the aging process. They do not expand as easily as they used to, which means the body must recruit more muscles and energy just to take in air. This alone can cause breathlessness in situations that once felt simple. The respiratory muscles also weaken, making deep breathing more difficult. At the same time, the heart becomes more sensitive to drops in oxygen. Seniors who already have conditions such as high blood pressure, diabetes, or mild heart disease are even more vulnerable to this shift. What might be a minor asthma episode in a younger adult becomes a more significant cardiovascular event in someone older. One of my patients, a 74-year-old man, had been experiencing chest discomfort for months. He was certain it was cardiac in nature. Every evening, he felt a mild pressure that disappeared after resting. He believed it was his heart slowing down due to age. But after several evaluations, it became clear that his real challenge was chronic asthma that had been quietly active for years. His airway inflammation had forced his heart to work harder every day, and the resulting discomfort mimicked a heart issue perfectly. Once we treated his asthma correctly, the pressure eased, his energy returned, and his heart regained its rhythm. Aging makes the signals harder to interpret, and this is why so many seniors misdiagnose themselves or delay seeking help. Understanding how these changes interact brings clarity to the symptoms that once felt mysterious or confusing. Real-life cases showing the connection. Stories from real patients often reveal the truth more clearly than any medical explanation. One man, 70 years old, came to me because his heart seemed to race every night before bed. He believed he was experiencing anxiety since the sensation appeared without warning. But after deeper evaluation, we discovered that he had mild, undiagnosed asthma. Every evening, as the temperature in his bedroom dropped, his airways tightened. His breathing became restricted, and his heart had to compensate. Once he improved his indoor environment and began regular asthma treatment, the nighttime palpitations faded entirely. Another case involved a woman in her mid-60s who had early signs of heart failure. Her shortness of breath worsened each year, and many assumed it was purely cardiac decline. But once we addressed her chronic asthma and reduced airway inflammation, her heart function actually improved. It was a reminder that the heart often suffers because of hidden respiratory issues. Her breathing became lighter, her activity level rose, and her quality of life shifted dramatically. One of my most memorable patients was an 82-year-old woman who lived alone. She often described episodes of sudden fluttering in her chest that left her frightened. She thought her heart was failing. But when we treated her underlying asthma and improved her home's air quality, the fluttering episodes nearly disappeared. She told me she felt as if someone had lifted a weight she never knew she was carrying. These stories show how asthma and heart health influence one another in ways that are easy to miss but powerful once understood. Why seniors mistake asthma for heart problems, and vice versa. The overlap between asthma symptoms and heart symptoms is one of the biggest challenges for seniors. Chest heaviness. For example, is a common complaint in both conditions. Fatigue is another. Breathlessness, perhaps the most confusing symptom, shows up in heart disease, lung disease, anemia, stress, and even dehydration. It is no wonder many older adults aren't sure what to think. Some seniors describe their breathing trouble as a feeling of air not moving deeply enough. Others say their heart feels like it is skipping a beat. Both can be signs of lung restriction. When the airway narrows, the body often sends mixed signals. This confusion leads to delayed care because people assume what they are experiencing is normal aging or a minor heart issue that doesn't require urgent attention. Understanding the shared symptoms helps seniors recognize when something more complex is happening beneath the surface. It also encourages conversations with doctors that go beyond assumptions. The more precisely we can identify the source of a symptom, the more effectively we can treat it. When asthma puts extra stress on the heart, asthma affects far more than breathing alone. When asthma is not well controlled, it quietly increases the workload of the heart. Indoor pollutants such as dust, smoke, mold, and chemical fragrances can lead to airway inflammation that lingers for hours at a time. Cold air can also tighten the airways, especially during winter months. These environmental factors make the heart's job harder than it should be. Poor sleep contributes as well. When oxygen levels dip during the night due to asthma activity, the heart must work harder to compensate. Over weeks or months, this constant effort can wear down the cardiovascular system. Seniors who live with allergies that go untreated also experience more frequent asthma flares, increasing the burden on both lungs and heart. Medication misuse is another subtle but significant issue. Some seniors skip maintenance inhalers because they feel fine that day. Others rely too heavily on rescue inhalers, believing they address the root problem. The truth is that consistent, preventive treatment keeps airway inflammation low, which protects the heart from being pushed into overdrive. What seniors can do to protect both lungs and heart. The good news is that there are many simple ways seniors can safeguard both their breathing and their heart function. Small daily decisions make a tremendous difference. Reducing exposure to irritants, whether by cleaning indoor surfaces regularly or switching to fragrance-free products, helps keep the airway calm. Gentle breathing exercises practiced once or twice a day can increase lung capacity and allow the heart to work more efficiently. Light physical activity is incredibly beneficial. Walking for 10 or 15 minutes, stretching in the morning, or practicing chair yoga can all increase oxygen flow and strengthen respiratory muscles. Staying hydrated helps thin mucus, making breathing easier. Keeping the airway warm during cold weather prevents sudden constriction. Monitoring breathing patterns and heart rhythm is helpful too. Seniors who take time to notice when symptoms appear, how long they last, and what seems to trigger them are far more successful in managing both conditions. Before we continue, if this video is helping you understand your health, please subscribe, like, and share Senior Health Daily. It gives us the motivation to create more life-saving content for you. Scientific research consistently shows that when oxygen levels improve, the heart immediately benefits. Better airflow reduces cardiac strain and improves overall energy. Even small gains become meaningful when repeated day after day. Medical tests that reveal the connection. Diagnosing the link between asthma and heart health involves several important tests. Spirometry is one of the most valuable tools because it measures how effectively the lungs move air. This test often reveals airflow limitation long before symptoms become severe. Heart evaluations, such as EKGs and echocardiograms, help identify the impact of reduced oxygen on cardiac function. Overnight oxygen monitoring can show whether breathing changes during sleep. Many seniors experience nighttime oxygen dips without realizing it. Allergy testing is also useful because allergens frequently trigger inflammation that narrows the airway. When these tests are reviewed together, they give a complete picture of how the lungs and heart interact. This combined approach allows doctors to treat both systems instead of focusing on only one. Treatments that improve both asthma and heart function. medical treatment often begins with inhalers that reduce inflammation and improve airflow. These medications help relieve the strain on the heart by ensuring more oxygen reaches the bloodstream. Anti-inflammatory medications may be necessary for more severe cases. Breathing therapy teaches effective ways to expand the lungs and improve muscle strength. Some seniors benefit from nebulizer treatments if inhalers are difficult to use. Lifestyle adjustments complement medical treatment beautifully. Avoiding triggers, staying active, eating anti-inflammatory foods, and sleeping well all support healthier breathing patterns and better heart function. Many of my patients notice meaningful improvements in as little as 4 to 6 weeks once they begin consistent treatment. Their energy rises, their sleep deepens, their heart rhythm steadies, and most importantly, their confidence in their own health begins to return. Red flags seniors must not ignore. There are moments when symptoms must be taken seriously. Severe shortness of breath that appears suddenly or worsens rapidly is one of them. A heartbeat that becomes unusually fast or irregular without explanation is another. Chest pain or intense pressure should never be ignored. A wheezing sound that becomes louder or more constant is a sign that the airway is tightening. These symptoms are the body's urgent call for help. Acting quickly can prevent respiratory failure and protect the heart from long-term damage. Seeking immediate medical attention in these situations is not overreacting. It is being wise, aware, and proactive. As we come to the end of this conversation, I want to leave you with a truth that is both empowering and deeply important. So many of the symptoms that seniors brush aside as ordinary aging can actually be signs that the lungs and heart are asking for attention. A little shortness of breath here, a heavy chest there, a quickened heartbeat that you blame on fatigue or nerves. These moments are not simply age passing by. They are your body communicating with you in the only language it has. What I hope you take from our time together is that nothing about your health is inevitable. The body, even past 60 or 70, has a remarkable ability to adjust, strengthen, and heal when we listen to it with patience and compassion. I have witnessed so many older adults regain energy, breathe more freely, and feel their hearts settle into a calmer rhythm once they finally understood the hidden link between asthma and heart strain. Every small step you take to support your breathing becomes a step toward protecting your heart as well. Thank you for trusting Senior Health Daily enough to sit with me through this important journey. Your willingness to learn, to reflect, and to take ownership of your well-being is what truly makes the difference. I am honored to walk beside you, offering guidance in a world that often overlooks the wisdom and resilience of older adults. Let this be your reminder that awareness is a form of strength. When you care for your lungs, you care for your heart. When you respond to your body with gentleness, you create room for years of independence, comfort, and peace. If this video brought you clarity and comfort, I invite you to subscribe to Senior Health Daily so we can continue walking this wellness journey together.